Hi, welcome back to First Aid with Jay. Today we'll be talking about heart attacks and discussing different things about them that you need to know and are kind of important. So first of all, what is a heart attack? The heart is a muscle that pumps blood around the body, and when it stops, that is what we call a heart attack. So like every other muscle in the body, it requires a good source of blood and nutrients and oxygen, and it is the most important, one of the most important organs in our body, just because it is the one that actually pumps those materials to the rest of the body. So it also pumps blood, which can get rid of waste materials like carbon dioxide and stuff. So it's important for dual meanings. So there's different reasons that a heart can stop and someone can have a heart attack. So first of all, there could be a blood clot. There could be blockage to the arteries that surround the heart, which makes it so it could not get blood. Another reason why it could is because of possible shock. So if someone goes into shock, they could have a heart attack. If someone is shocked by something like electricity, it could interrupt the heart and cause it to stop and pause. So it's important to recognize, first of all, if someone does have a heart attack, that they have a heart attack. So first of all, a lot of times they'll have chest pain. So in the early symptoms of a heart attack, you can tell someone might have a heart attack because of like chest pain around where the heart is, shortness of breath. So they're suddenly being uncontrollably, like it's hard for them to breathe. The person will become pale, sweaty, like their colors draining from their face. They're really anxious. They could be fearful. And then if you feel their heart and it has a really irregular or weak pulse, those are signs that they're having a heart attack and it could possibly stop. Not all of these symptoms may be present, but at least some of them. So if someone's having a heart attack, they will show some of those symptoms. And so it's important to check for all of those and to make sure that that the patient that you can diagnose the heart attack. So first of all, you want to call an ambulance, first aid professional help to get to the scene, because they're the ones that ultimately can save the patient. You're just there. If the person is having a heart attack, you just want to make sure that they're comfortable. Have them sit on the floor. The best position is a W position, where their knees are raised up and they're sitting up, and this also reduces strain on the heart. And then another thing that possibly could help is have them take an aspirin. And aspirin, basically what it does is, because it thins the blood and allows it to pump more freely. If they have other medication, ask them for that and see if you can administer it. But if not, aspirin is the best thing that you can do for them. Basically, yeah, be prepared to have sudden cardiac arrest, which is when the heart stops beating completely. And if you do that, you might have to do CPR. So just be ready in case, because if their heart is still weakly beating or irregularly, it's still beating at least a little bit. And so just be there ready in case their heart goes into full lockdown. And that's all I have today for heart attacks. They're really serious, important, but if you know the signs, you can help be a big difference in someone's life. So thanks for tuning in. See you next time on First Aid with Jay.